I'm demonstrating the evaluation for a side bent tailbone. They're usually caused with a trauma, typically an asymmetrical fall onto the buttock. And what I do is I lay my hand, so here's the waist, here's his belt. Sacrum is right around here. I can pretty much see it. So I lay my hand onto the sacrum and I fold my middle finger onto the tip of the tailbone. Okay, of course I explain to the patient prior to that. I tell him exactly what I'm going to do. I then come on each side with my index finger. So there's about an inch between my fingers, and I'm going to lift up towards his head. So I lift up into the sulcus created by the transverse processes of the first coccygeal segment. Now, if his tip was pointed off to the left, then the transverse process on the left side would be higher. So I would have a deeper sulcus coming up on his left side, okay? I also want to test ligament tone. So just for the purpose of filming, I usually stand over here and face the patient looking this way, but for our filming purposes, we're going to do otherwise. So we know this is tip of the tailbone. I come wider now. So now there's at least 1.5 inches or more between my index fingers, and I lift up, and that's bony, so I know that I'm under the inferolateral angles of the sacrum. If I get much wider, I would be in soft tissue land. So, all right, so I know that I'm at the bottom of the sacrum on each side. So if I come laterally another inch, meaning 1/2 inch on each side, and just roll up and down and deeper each time, I can tell this is ligamentous tissue. It has a very different quality than muscle. And I'm going to now indent it, and I'm going to spring with my right index finger, and now I'm going to spring with my left one, and we're going to pretend that he had a right side bent sacrum, in which case his right sacrospinous ligament would be tighter, and so I would not be able to indent it or take up the slack unless it took up very, very quickly, at which point I would not be able to spring it, okay? The last test that we need to do is perform a spring test. So I'm at the tip of his tailbone. So I'm going to come with my thumb in here. I got to dig in through soft tissue. I'm now on the left side of his tailbone. I'm going to stack my thumbs, okay? And I'm going to push into it with about 5 pounds of force. And I've practiced on a bathroom scale or on a postage scale. And if his tailbone was side bent to the right, then the tip would go to the left, and it would not be able to spring back to neutral, okay? So the spring test going left to right would be blocked. And then I come over on the other side, I can stack thumbs, and I'm going to spring it towards me, and I'm now able to take up the slack, okay? And now at the count of 3, I'm going to spring it 1, 2, 3, and it has movement. There's that little tiny spring and recoil, okay? So that is the evaluation for a side bent tailbone. Thank you.